Hello everyone. In this video we will talk about alcohols and the free video notes of this lecture will be available for free download from the app. So when we talk about alcohols, we are mainly focusing on three alcohols, that is ethyl alcohol, which is known as ethanol, methyl alcohol, which is known as methanol, and ethylene alcohol. Now these alcohols are not used in prescription, rather they are either consumed either accidentally or they are part of toxicology or they are the drug of abuse, that is ethanol. Okay, though ethanol is a component of a spirit and somewhere it can be used for antiseptics and sometimes as a for rubbing the skin, but these are not used as prescription drugs, please remember that. So when we talk about alcohol, basically we are discussing their effects on the body and how to go for de-addiction and decrease their effects or prevent the toxicity. So for that we need to understand what is their, how they are metabolized in the body and what are the products which are produced. So all of these three alcohols are metabolized by two enzymes. First one is alcohol dehydrogenase and the next one is aldehyde dehydrogenase. So ethanol or ethyl alcohol is converted by alcohol dehydrogenase to acetaldehyde and this acetaldehyde is converted by aldehyde dehydrogenase to acetic acid. And this conversion is quite fast and these products actually don't accumulate and they are not harmful in the body in the usual conditions. Methanol is converted by alcohol dehydrogenase to formaldehyde, which is converted by aldehyde dehydrogenase to formic acid. So you see here that there is a pattern. First there is a aldehyde forming and then there is a acid forming. So these, when we talk about methanol, formaldehyde and formic acid both are toxic to the body. Mainly they cause a retinal damage. So basically, if this is consumed, it is toxic and it leads to death as well. Okay. Then ethylene glycol. Ethylene glycol is basically present in industrial solvents. It is an antifreeze and it is converted by alcohol dehydrogenase to glycoaldehyde and it is converted to glycolic acid by aldehyde dehydrogenase and glycolic acid is further converted to oxalic acid. Okay, so it leads to acidosis and there is further damage that we are going to see further. Okay, so this concept should be clear that there are two enzymes, alcohol dehydrogenase and aldehyde dehydrogenase. Now moving on to ethanol, which is basically a very common form of abuse. Okay, it is not used as prescription, but because of its euphoric action, it is very commonly consumed by people. So it has many actions. Most important one, which is for which it is used for consumption, it is its action on CNS. It leads to CNS depression. But then how CNS depression will lead to this euphoric action? Well, first affected are the inhibitory areas where GABA neurotransmitter is released, that is affected first. So decrease in GABA release leads to excitation. So initial effect is excitation and euphoria. And later on, as its consumption increases, the blood levels of alcohol rise. It leads to sloppiness, ataxia and impaired performance. That means there will be decrease in concentration, decreased attention and further increase leads to decreased consciousness. The person will feel sleepy. Though he is feeling sleepy, it is not actual sleep. You understand that sleep architecture is disrupted and the further increase will lead to death as well. Okay, so there will be respiratory depression and it will lead to death. Okay, so mechanism of action by which this is occurring is first is not increase, there is decrease in GABA release and it also causes decrease in glutamate release further. So that is going to lead to decreased excitation. So this initial effect is causing excitation and further it leads to CNS depression and the euphoric action is also because of the dopamine release. So some effect of dopamine release is also there which is responsible for its euphoric or pleasant effect. Other actions of alcohol include local action in which it is used as a spirit basically in 70% concentration and because it precipitates proteins at this concentration, that is why it is used as antiseptic. You might have used this spirit in your physiology lab, path lab for cleaning your finger or whenever taking blood samples spirit is used. Then it is, if injected around the nerve, it can cause nerve damage and that is why it can be used for intractable neuralgia, for damaging the nerve if the pain is not controlled by other methods. Okay. Then we have CVS. Actually, it causes cutaneous vasodilation. So on your skin there is vasodilation, and whenever there is vasodilation on the skin, what will happen? There will be heat loss. Okay. So what happens that initially, because of the vasodilation on the skin, the person will feel warmth. Okay. But because of excessive heat loss, because of this vasodilation, actually the body temperature is going to drop. So you might have seen in movies that in cold areas, people are consuming alcohol, but it is a wrong thing to do in cold areas, because it is just giving a sensation of warmth for some time, but because of excessive heat loss due to vasodilation, ultimately there will be drop in body temperature. So alcohol consumption during cold is not advised, right? Then GIT, there will be increased gastric secretion, so this will lead to gastritis, and the frequency of opening of lower esophageal sphincter increases, so that leads to gastric reflux as well. So it is not advisable that a person who is having peptic ulcer or gastritis should drink alcohol. So even though alcohol is not used for prescription, but you will see many people consuming this, so you should advise these patients not to consume alcohol. Then binge drinking can also lead to acute pancreatitis, rather it is the most common cause of acute pancreatitis. Then chronic consumption over years can lead to fatty liver and damage to liver cells. There is oxidative stress to the liver cells, and this will lead to damage to the liver cells. And once that damage occurs, there is compensatory response by the body, and there is fibrosis. So ultimately it leads to fibrosis in the liver cells, that is the cirrhosis. Okay. So chronic intake will damage the liver. Then it also leads to myopathy, chronic intake. So there will be protein loss, and it will lead to weakening of the skeletal muscles and myopathy. Then the people who consume alcohol will tell you that there is excessive urination as well. That is because alcohol is an effect of decrease in ADH release. So if ADH is released less, that is antidiuretic hormone which acts on the kidneys. So there will be decreased reabsorption of water from the kidneys, and this leads to diuresis. Okay. So it can ultimately lead to dehydration as well, excessive diuresis. Okay. Now what are the drug interactions? So first thing is that you see, I told you about this metabolism. Ethanol is metabolized by alcohol dehydrogenase to acetaldehyde, and which is further metabolized by aldehyde dehydrogenase to acetic acid. Now there is a drug disulfiram. Disulfiram inhibits this enzyme aldehyde dehydrogenase. So what is going to happen? Acetaldehyde will not be converted to acetic acid. This pathway will be blocked, and there will be accumulation of acetaldehyde. Understand me? See, normally this doesn't happen because acetaldehyde is converted to acetic acid very fast. So acetaldehyde does not accumulate in blood. But once this drug blocks this aldehyde dehydrogenase, there is accumulation of acetaldehyde, and this leads to aldehyde syndrome, which is a very dangerous condition. The person will feel flushing, there will be throbbing headache, chest tightness, perspiration, vomiting, dizziness. Person can collapse also. Fainting will be there, collapse can be there, and if it is extreme, it can lead to death as well. So this drug is used in certain therapy. We will see later. But remember that we are talking here about drug interactions. So there are other drugs as well which inhibit aldehyde dehydrogenase. These include cefoperazone, sulfonylureas, griseofulvin, metronidazole, and these drugs have disulfiram-like reaction with alcohol. Okay, so cefoperazone is an antibiotic, sulfonylurea is an antidiabetic, griseofulvin is antifungal, and metronidazole is also antibiotic. So you can remember it is like GMC. Okay, so GMCs I remember. So just put it as griseofulvin, metronidazole, cefoperazone, and sulfonylureas. So if these drugs are taken by the patient and he intakes alcohol, then he can have these disulfiram like reaction, and the person can die as well. So when these drugs are started, the person has to be counseled not to take alcohol. Then since alcohol is a CNS depressant, so any CNS depressant along with alcohol will cause marked CNS depression. So again, it can be dangerous. So drugs like antidepressants, opioids, antihistaminics, anti-anxiety, all can cause marked CNS depression with alcohol. Then, alcohol induces its own metabolism. First of all, remember that because it activates some cytochrome enzymes, because of which it induces the enzyme for its own metabolism. That is why tolerance to alcohol develops. Okay, so if the person is taking alcohol chronically, then same dose may not be sufficient for him to have the same effect, and the tendency to increase the amount of alcohol increases. Second, it induces this enzyme, cytochrome P450 enzyme, and this enzyme is responsible for converting paracetamol to this toxic metabolite, that is N-acetyl benzoquinoamine, and this is responsible for liver toxicity. So, with alcohol, if the person is consuming alcohol, the safe dose of paracetamol decreases. So, we have talked about this paracetamol toxicity in our video on NSAIDs. You can have a look. Then NSAIDs plus alcohol, there can be increased tendency of GI bleeding, because alcohol, we have seen that it increases gastric acid secretion, and NSAIDs also are damaging to the gastric mucosa. So there can be increased tendency of GI bleeding. Then alcohol actually causes hypoglycemia. Okay, so if the person is on anti-diabetic drugs, then there can be more chances of hypoglycemia. So what are the contraindications? Again, there are no indications for alcohol, but contraindications we are studying because there is a huge population which consumes alcohol. So we have to advise them against the consumption of alcohol in various conditions. One is peptic ulcer because of increased gastric acid release. Epilepsy, because alcohol actually lowers the seizure threshold. It lowers seizure threshold. Okay, that is important. So in epileptic condition. Then in liver diseases, because it will lead to more damage to the liver cells. In pregnancy, it causes fetal alcohol syndrome, where alcohol can lead to low birth weight, growth retardation basically. Then it can also lead to issues with the central nervous system development. The baby will have low IQ, even a small head size will be there, and there can be various cognitive problems. Then unstable personalities, better to avoid alcohol because their behavior becomes erratic and they can become violent as well. But that is the irony, that unstable personalities consume more alcohol and it can lead to irrational decisions and behavior. Then chronic alcoholism. Now chronic alcoholism is a problem because it leads to malnutrition. See, an alcoholic generally gets his energy from alcohol itself, and there is a tendency not to take food. So there is consumption of empty calories, and many times avoid taking food. So it leads to malnutrition. There can be neurological problems because of vitamin deficiencies. So it can lead to Wernicke's encephalopathy, Korsakoff of psychosis, and megaloblastic anemia. Then liver cirrhosis, over a period of time it will occur. Acute pancreatitis if binge drinking is occurring. Then it can also increase blood pressure, lead to hypertension, and also muscle weakness, that is myopathy. And if such a person does not take alcohol, so there will be withdrawal syndrome as well. Okay, so there will be anxiety, sweating, tremors, increase in heart rate, sleep impairment, confusion and collapse, and the person will be forced to consume alcohol. So because of this, there is various strategies for de-addiction. So three main strategies are used. One is the replacement substitution therapy. Okay, so this is substitution therapy. Now these strategies are common for all drugs of abuse. Okay, so either whatever is the drug, you replace it with a drug which is long acting. So we can use benzodiazepines for this. There are other drugs also which were used, but now benzodiazepines are the drug of choice for this. They are used as replacement therapy or substitution therapy. Then we have alcohol aversion therapy. So in this, we don't give it when the person is consuming alcohol daily. For giving this, the person should not consume alcohol, please remember. So what we do is give disulfiram, and if the person consumes alcohol, he will have very serious effects that we have already seen, that the person can collapse, he will have fainting, he will have anxiety and chest tightness, throbbing headache will be there. That is the aldehyde syndrome. So this is alcohol aversion therapy. That means the person will be so averse to drinking the alcohol because of all these negative symptoms which he has felt. He will be really feared to even touch the alcohol. But remember, we have to be really careful because the person can die also if this reaction is severe. Okay. Then the other is that once the person has stopped consuming, okay, so once the person has stopped consuming alcohol, we have to prevent the relapse. So for that, we should ensure that there is decrease in craving, because if craving to consume alcohol is there, then there are high chances that the person will relapse. So to decrease the chances of relapse, we have various drugs. Naltrexone is there, which is opioid antagonist, so it helps prevent relapse. Then we have ondansetron, that is the 5-HT3 antagonist. Topiramate, an anti-epileptic drug, has also been found to decrease craving. And another is an MDA receptor antagonist, that is acamprosate. So you can remember this with the mnemonic NOTA. Okay, so NOTA, naltrexone, ondansetron, topiramate and acamprosate. These drugs decrease the craving and hence decrease the chances of relapse. Now moving on to the other alcohols, that is methanol and ethylene glycol. So methanol is basically of toxicological importance, because if this methanol is mixed with liquor, which happens in case of local liquor, so in shops they mix it with methanol to decrease the price further, and this can actually lead to retinal damage, because as it is metabolized to formaldehyde and to formic acid, it can lead to retinal damage. And you can read the news, there are lots of incidents of this retinal damage because of this mixing of methanol with ethanol. So for this, instant treatment has to be started. So first is supportive treatment should be there. Then to maintain the pH, because you see formic acid is being formed, IV sodium bicarbonate is given, which is going to neutralize this acid, and this is very effective treatment. It has to be done, IV sodium bicarbonate. Hemodialysis to remove the methanol and also the metabolites, that is formic acid, from the circulation. Then folate therapy. Folate therapy basically it promotes the metabolism of this formic acid. Then ethanol, that is the ethyl alcohol, which we have been reading till now. So ethyl alcohol, you may ask that why we are giving this, it itself is an alcohol. Yeah, it is there, and you don't have to give the person to drink this alcohol. You have to give it by nasogastric tube directly to the stomach, and when it is absorbed into the blood, it will use these enzyme alcohol dehydrogenase and aldehyde dehydrogenase and will saturate these enzymes, so that the methanol which is there, it is not converted to formic acid. So that is continued for a period of time till the methanol clears from the blood. But it is not the ideal treatment, because we cannot decide whatever is the dose of the alcohol which needs to be given for maintaining a particular concentration of alcohol in blood, so that these enzymes are saturated. So not the ideal treatment. Instead, the drug of choice for this is fomepizole, which is given IV, and this drug blocks the enzyme alcohol dehydrogenase. So by blocking it, it prevents the conversion of methanol to formaldehyde and to formic acid. So that is methanol. Last one is ethylene glycol. Ethylene glycol, as I told you, that it is an industrial solvent, and this can be consumed by people accidentally. So this ethylene glycol, like the other two glycol, is converted by alcohol dehydrogenase to glycoaldehyde, which is converted by aldehyde dehydrogenase to glycolic acid, and which further is converted to oxalic acid. So we have various features of this poisoning, that is, there will be history of consumption of industrial solvent, there will be decrease in blood pH, acidosis will be there, and oxalic acid will lead to development of kidney stones, and it will also lead to renal tubular necrosis. So in this case, we think of ethylene glycol poisoning, and again the drug of choice for this condition is again same, fomepizole. And this drug, again, it is going to inhibit the alcohol dehydrogenase and prevent the formation of this acid. So that is the methanol and ethylene glycol poisoning. So with this, we finish our alcohols, that is ethyl alcohol, methanol and ethylene glycol. Thanks for watching the video. If you liked it, do press the like button, do share the video with others, and don't forget to subscribe to the channel Physiology Open. Thank you.